Yes, this is Dr. Malik Rahim, and today I want to talk to you a little bit about treatment planning. Um, Part of an effective mental health treatment plan is the development of the treatment plan. A good mental health professional will work collaboratively with the client to construct a treatment plan that has achievable goals that provide the best chances for treatment success. Um, what exactly is a treatment plan? At the most basic level, a mental health treatment plan is simply a set of written instructions and records relating to the treatment of an ailment or illness. A treatment plan will include the patient or the client's personal information, the diagnosis or diagnoses, as often the case with mental illnesses, a general outline of the treatment prescribed, and space to measure outcomes as the client progresses through treatment. A treatment plan does several things, the most important of which include the definition of problem or ailment, describing the treatment prescribed by the mental health professional, setting a timeline for treatment progress, whether it's a vague timeline or includes specific milestones, identifying the major treatment goals, and noting important milestones and objectives. This treatment plan, this document, uh, the most important components help the client and the therapist stay on the same page. And it provides an opportunity for discussion of the treatment as planned and can act as a reminder and motivational tool. A wide range of people can benefit from mental health treatment plans. These include people living with serious mental illnesses, people experiencing distress in one or more areas of life, children, parents, and or families, the elderly, individuals, couples, people with different intellectual or developmental disabilities, people experiencing sexual or gender identities, just a whole range. Okay, so while people in similar circumstances with similar issues may have similar treatment plans, it is important to understand that each treatment plan is unique. Um, there are often many different ways to treat the same problem. Sometimes there are dozens of different paths that treatment can take. So no two treatment plans will be exactly the same because no two people experiences are exactly the same. So when you look at a treatment plan, what exactly goes into a treatment plan? While the basic components of mental health treatment plans are listed, I'm going to talk about, there are many more possible additions to a treatment plan. So this template I'm going to talk about is the primary template, but it can vary so vastly. Okay, so what are the major components? A history of demographics, client psychosocial history, the history of the symptoms, any past treatment information, assessment or diagnosis. The therapist or the clinician diagnosis of the client's mental health issues and any past diagnosis will also be noted. Presenting concerns, the problems or symptoms that initially brought the client in. Treatment contract, the contract between the therapist and the client to summarize the goals of treatment. Responsibility, a section on who is responsible for which component of treatment. Usually the client will be responsible for many, but sometimes the counselor or the therapist for others. The the strengths and resources the client brings to treatment can include family support, um, spiritual support, um, character strengths, material support. Sometimes, we also call these protective factors. Treatment goals, the building blocks of the plan, which should be specific, realistic, customized specifically for your client and their needs, and they should be measurable. Objectives, goals are the larger, more broad outcomes the therapist and the clients are working for. While multiple objectives make up each goal, they are small, achievable steps that make up the goals. Modalities, the frequency and the targets. Different modalities often apply to different goals, requiring a plan that pairs modalities, a frequency of sessions, anticipated completion date, and all these with the respective goal. Interventions, the techniques, exercise interventions that will be applied in order to work toward each goal. Progress or outcomes. A good treatment plan must include space for tracking progress towards objectives and goals. Okay? Sometimes new counselors want to know, why should you use a treatment plan? And besides the obvious benefits that treatment plans give you, there are a few specific advantages that can really help impart to those who use them. And these include 4 basic components. Treatment plans provide a guide to treatment for both the therapist and the client. Treatment plans can reduce the risk of fraud, waste, abuse, and the potential to cause unintentional harm to clients. Treatment plans facilitate easy and effective billing since all services rendered are documented. And 4, treatment plans can help smooth any potential bumps in treatment, especially if a client requires a kind of treatment the primary therapist cannot provide. Example, a certain type of intervention or prescriptions for medication. So those are the key components. So while treatment plans are quite popular in mental health treatment, it should be noted that not every therapist or client will use one. Treatment plans are not necessarily required to give or receive successful treatment, but they can be extremely helpful in facilitating a smooth and hassle-free treatment experience.